Welcome to the Psych and Business Podcast. We're here to show you how practical psychology can be useful and make your workplace better. I'm Dr. Ernest Wayde. Now, I've been thinking about how to make sure that the individual episodes remain practical and helpful. And I think the best way to do that is by giving you examples. But I don't want to just give one or two off examples. What I want to do is tell stories. I think stories are a great way to get across a message. They can be both entertaining and educational. Now, the story we're going to walk through is fiction, but it represents many of the organizations and the employee experiences that I have seen in my work today. And so I think it's fair to say that this story is representative of the world that we live in today and how people are experiencing it in the workplace. So let's get practical and talk about Blue Rivers Hospital. Now, Blue Rivers Hospital is a nonprofit hospital that was established in about 2010 to serve the growing population in the Twin Cities of Minneapolis and St. Paul. Blue Rivers is physically located in Minneapolis and was a very successful hospital with a maximum capacity of about 650 beds. If you're not sure what that means, it basically means that Blue Rivers is a mid to large size hospital. So for 10 years, the hospital was a great place to work and a great place to get medical treatment. It actually won awards of being some of the best places to work in the Twin Cities. Then COVID hit about 2010. Now, while most people would think that a pandemic would be good for business, COVID was actually a significant economic challenge for Blue Rivers because Blue Rivers gained a lot of its revenue through elective and outpatient services, which were all canceled or significantly reduced. So basically, Blue Rivers made a lot of its money through outpatient services, but they weren't able to make the money because of COVID. When if you remember COVID, everything pretty much shut down. Now, in addition to that, the cost of supplies skyrocketed because of the lack of supplies. It was really hard to get anything, and so costs of supplies were pretty high. Now, despite all of these challenges, the greatest challenge faced by Blue Rivers was actually the staffing issue. The extreme stress of the pandemic, coupled with the experienced trauma, burnout, and just the general exhaustion of the Blue Rivers workforce led to a decline in employment, a pretty significant decline. Now, while other hospitals have been able to recover, Blue Rivers was not able to recover. And so this has led to 4 years of continued decline in the overall hospital performance. In an attempt to stop the decline and get Blue Rivers back to its former glory, the CEO has tried numerous things, including implementing freezing wages, reducing leave, eliminating work schedule flexibility, implementing a new electronic health record, and mandating the whole organization train and lean to try to increase efficiency. Unfortunately for Blue Rivers, none of this has worked to improve their profits or pull them out of the slump. And as we see happening in many hospitals around the country, Blue Rivers was acquired by a healthcare system called Optima Healthcare System. Now, Optima Healthcare System, or OHS, was based in Kansas, and when they acquired Blue River became the 40th hospital in their system. So you can see that OHS is also a mid to large healthcare system with numerous other hospitals in there. The announcement of the acquisition was actually made to the staff by the CEO through an email a few hours before the news was actually reported online. After the acquisition, the current CEO took a new position elsewhere, leaving the position of CEO of Blue Rivers vacant. The current Chief Medical Officer of Blue Rivers, Dr. Emily Carter, was asked by OHS to step in as acting CEO until a new permanent CEO could be found. Dr. Carter thought about it and she agreed. At her very first individual meeting with each of her executive team members, Dr. Carter spoke with her chief financial officer, and the chief financial officer told Dr. Carter that Blue Rivers was actually experiencing a continued reduction in revenue for the hospital. So they were actually losing money. She also talked to her chief operating officer and heard that the patient satisfaction scores were down and that employee turnover was up, which all resulted in higher costs overall and was damaging the reputation of the organization. Now, Dr. Carter is determined to help Blue Rivers get back to being profitable, but she's not quite sure where to start. Then she remembers that in her leadership training course that she took when she first became a chief medical officer, there was a framework that was introduced to her that had some of the elements that she's heard of, specifically employees, customers, and profitability. And so Dr. Carter thought that this might be helpful to her. So she went to her notes and dug it up. And she found the service profit chain. Now, the service profit chain was actually introduced by management faculty at Harvard Business School in the early 1920s, specifically Haskett, Sasser, and Schlesinger. And they proposed a framework to help explain the relationship between organizational profitability, customer loyalty, employee satisfaction, and productivity. So, very basically, the service profit chain shows how profit and growth are stimulated by customer loyalty. Customer loyalty is a direct result of customer satisfaction. And customer satisfaction is heavily influenced by the value of the service provided to customers. Value is created by satisfied, loyal, and productive employees. Employee satisfaction occurs when they feel supported through services, policies, and their leaders. So, based on this framework, Dr. Carter now believes that she has a better understanding of how all of these factors are related, specifically how the employee turnover is related to the poor customer satisfaction scores and the lack of profitability in the organization. And so she determines that she's going to focus on her employees as a way of addressing the problems with reduced revenue, patient satisfaction, and the high turnover. So, at this point in the story, Dr. Carter has learned about the service profit chain. She's learned about how employee engagement impacts value, which impacts customer satisfaction, and loyalty, which impacts profitability. And already we can see how human behavior is impacting profitability of the organization. So I want to invite you to think about this model, this framework, and think about how it applies in your workplace. How does your leaders, your policies, and the services that you provide to your employees impact employee engagement and employee satisfaction? How does the value that your employees provide impact customer satisfaction and customer loyalty? And how does that impact growth and profitability in your organization? Apply this framework to your organization and see how well it fits. See where the weak links might be in your chain, or if there are any broken chain pieces that you need to address. And join us next time as Dr. Carter begins to focus on the Blue River employees. If you've enjoyed this episode, please consider subscribing and leave us a review. Feedback is a gift, and we love gifts. Thanks for listening. I hope you'll join us again next time.